Well, good evening, and thank you all so much for joining us for this important conversation. And I'd like to begin this evening by acknowledging the incredible work of our healthcare professionals who have been instrumental during this crisis. Healthcare extends beyond our traditional institutions. We have an entire ecosystem of support, care, and prevention services that exemplify the importance of the private-public partnerships which are essential in combating this global pandemic. Because of our collective work, Howard County was able to flatten the curve and slow the spread of COVID-19. As of this morning, we have administered a total of 92,878 tests here in Howard County, with a 2.64% positivity rate, and a total of 21.1% of our population has been tested. Our positivity rates continue to trend downward as the county increases testing and is well below the CDC and the governor's goal of 5%. When we announced our HOCO Rise framework, our plan was to reopen innovatively, safely, and efficiently. One of our goals was to reach at least 6,500 tests per week. We are proud to have surpassed that goal for 6 consecutive weeks and administered more than 7,700 tests just last week. Another goal was to ensure adequate hospital capacity in the case of a possible surge. Howard County General Hospital has 30 staffed acute care beds, 16 ICU beds, and 41 ventilators. Today, there are 14 COVID-19 patients in both ICU and acute care units. Additional capacity is available in medical tents should we need it. In our HOCO Rise framework, we also had a goal of securing adequate PPE, or personal protective equipment, and having enough on hand for 30 days, a goal which we have secured and continue to hold. And finally, while we began with 2 contact tracers in Howard County, our goal included having 15 per 100,000 in our population. We have achieved this goal with 49 contact tracers here in Howard County, in addition to the state's efforts to help us track the spread of COVID-19. Contact tracers continue to reach out to all cases in their contacts for residents who tested positive for COVID-19. For cases with phone numbers, 97% of the cases are contacted within 24 hours of a positive result. These calls are important to prevent transmission to anyone who may have been exposed, but please remember, answer the call from the Howard County Health Department. Or COVID Link. This is a group effort, and we've learned quickly over the last 5 months how to work together to combat this virus. COVID-19 has exposed the challenges and disparities that already existed in our community, things like mental and behavioral health, racial inequalities, and access to affordable health care. And that's why tonight I'm excited to bring this collaborative group together to address these issues and provide insight on what they've experienced in their roles in healthcare. I also want to just acknowledge, in case you dropped in late, Angela Cabellin, who serves as not only our Deputy Chief Administrative Officer and our Chief Innovation Officer, but also our liaison when it comes to health and wellness. So, Let's start tonight by getting to know some of our panelists a bit more and learn how their work intersects with one another. So I'm going to turn. Oh, okay. So I'm going to turn it back over to Angela right now.
Perfect. Thank you so much, County Executive. We're going to take this moment to introduce our prestigious panel. And thank you all for chiming in again. We will be taking questions from WebEx chat, Facebook Live, and also covering any questions that were sent during the registration. So before we go into those questions that the County Executive will kick off, I want to introduce our panel. First, we have Denise Giuliano. Denise Giuliano is the Executive Director of the National Alliance of Mental Illness of Howard County, or NAMI. Prior to NAMI, she did extensive volunteer work for the Community Action Council's Head Start program and the Howard County Public School System. Her background is in public policy, having worked on Capitol Hill for 6 years as an education and healthcare lobbyist for 2 years prior to raising a family. Dr. Matt Levy is the Medical Director of the Howard County Department of Fire and Rescue Services, starting as a volunteer EMT over 2 decades ago. He is a fellow of the American College of Emergency Physicians and a fellow of the Academy of Emergency Medical Services. Dr. Levy is an associate professor of emergency medicine of the Johns Hopkins University School of Medicine. He is also a clinical associate professor and medical director of the UMBC Department of Emergency Health Services, and also serves as the Central Maryland Regional Medical Director for the Maryland Institute for Emergency Medical Services Systems. Next, we have Dr. Yvette Okendo-Buruz. Dr. Okendo-Buruz is a board-certified family physician who joined Care First Health Services Division in 2017. While serving the armed forces for 10 years in the U.S. Army, she achieved the rank of Major and received Army Commendation and Achievement Medals. Wellness and prevention were at the center of the way she practiced family medicine for 31 years, and she has held multiple leadership roles and currently is a Maryland delegate to the Congress of Delegates of the American Academy of Family Physicians. We have Lisa Pearson joining us today, who has practiced clinical social work as a therapist for 15 years in multiple states and has worked in schools, residential treatment facilities, and currently in an outpatient setting with Chase Brexton Healthcare, the only federally qualified health center in Howard County, providing many services to insured, uninsured, and underinsured members of our community. As the director of the Behavioral Health Department, her focus is on broadening the acceptance of therapy across racial and ethnic diverse groups as a mode of help for mental health challenges. Dr. Patricia Pugh joins us, who serves as Vice Chair of the Department of Emergency Medicine at Howard County General Hospital, Johns Hopkins Medicine. She brings several years of experience in emergency medicine, leadership, as well as over a decade of experience as an emergency medicine specialist. She is committed to delivering high-quality, evidence-based care to all members of the Howard County community. Dr. Mara Rossman is the health officer for Howard County Health Department with 25 years experience in public health. She was appointed health officer in 2012 and has worked for Howard County Health Department since 2007, serving as medical director and deputy health officer of clinical services. Prior to these roles, she served as the medical director of school health for 10 years in the Baltimore City Health Department, and also spent 10 years in academic pediatrics and as a neurodevelopmental specialist. Dr. Ralph Semmel, who joins us today, became the 8th director of the Johns Hopkins University Applied Physics Lab, APL, in 2010. He leads the nation's largest university-affiliated research center with 7,000 staff, performing research and development on behalf of the Department of Defense, the intelligence community, the National Aeronautics and Space Administration, and other federal agencies. APL was ranked number 3 on Fast Company's Best Workplaces for Innovators list. Great news for APL and a reflection of the collaborative and innovative environment in Howard County. Steve Snellgrove joins us, and he is the president of Howard County General Hospital. He is responsible for the overall operation and direction of the hospital. With more than 35 years of healthcare management experience, he joined the team in 2014. His focus is on improving the patient experience and working with community partners to establish a healthcare system that delivers on health, wellness, and disease prevention. Steve serves as chairman of the Maryland Hospital Association's Behavioral Health Task Force and is the chairman of the Howard County Economic Development Association. And finally, we have Dr. Celian Valero Colon, owner and physician of One World Healthcare, is board certified, obtaining her medical degree from the Universidad Central del Caribe Medical School in her homeland, Puerto Rico. Following completion of the Johns Hopkins University Sinai Hospital residency internal medicine program, she spent more than 10 years as an internal medicine hospitalist and outpatient physician in the Baltimore area. She believes in a preventive approach to wellness. We are so excited to have all of our prestigious panel join us, many who are residents who live, work, and play right here in Howard County. Thank you, and I'll turn it back to County Executive Calvin Ball.
Thank you very much, Angela. And I'd like to start with some of our frontline health workers. Dr. Levy, can you provide a behind-the-scenes look at the role that you played during the pandemic and how things have changed? How has EMS here in Howard County adapted to remain safe and responsive for our residents?
Dr. Levy, you might want to unmute yourself.
Is unmuted. Hey, can you all hear me now?
Yes.
Okay, I see some smiles. I'll go with that. Well, good evening, everybody. Dr. Ball, thank you for those kind words and the introduction. And I would be remiss if I didn't start off by saying just what a phenomenal team of frontline healthcare heroes we have in Howard County. And that extends well beyond our first responders, but certainly includes them. Our first responders in Howard County stand ready to answer the call, no matter what it may be, 24 hours a day, 365 days a year. And no truer has that been, but for COVID-19 as well. And as the medical director of this incredible team of heroes, it's been my responsibility for the oversight and guidance of all emergency medical patient care activities that take place, both COVID related and non-COVID related. We very much continuously operate on this cycle of training and preparedness and readiness and response to those emergencies and learning from what worked, what didn't work, and getting ready for the next emergency. Specifically with regard to COVID-19, over these past months, and this actually started, we began really thinking about how COVID-19 might affect our emergency response infrastructure when we first heard of it making landfall in the Pacific Northwest in the midwinter. And during that time, we really began looking at our response plans and learning from what our colleagues around the country were experiencing and how do we implement treatment protocols to align with the best evidence in the practice. We were very instrumental in implementing a viral syndrome pandemic triage protocol that actually was implemented statewide. We were one of the first jurisdictions in Howard County to use that. And so it's been a continuous cycle of collaboration and learning and really just seeing what we can do to take the best and evolving evidence to apply it to someone having an emergency and how can we help them the most. But beyond that, what may not be as apparent is that the reach and the activities of our emergency medical services community and our professionals really now more than ever extend beyond and past the emergency call. And over the past 6 months, we've continued to grow and innovate in a number of initiatives to help improve health outcomes to those individuals in our community who may be at the greatest risk, who may have the least access to resources. And what we have observed is that that need is greater now than ever, as people are trying to continue to socially distance and trying to stay safe. So what I would like to just wrap up by saying is that we continue to collaborate with our public and private partners, many of whom I share the virtual stage with here tonight. And we stand ready to respond to the next call. It's been a journey of learning and of collaboration, and we will get through whatever the future holds in sight for us. So thank you.
Thank you so much, Dr. Levy, for that insight. It is always good to connect with you, my friend. Now, the pandemic has certainly changed the way that a lot of people receive care. And we have Dr. Pugh here from our emergency department who can probably speak more directly to this issue. We've heard from many people who are concerned as we approach flu season. Can you talk a little bit about how you're preparing for the fall and winter and the concerns that keep you up at night?
Absolutely. Thank you very much for having me here. I echo everything that Dr. Levy stated with respect to the power that we've had in delivering quality care, largely based upon the partnerships that we've had within the community. So I want to start by humbly saying thank you. To the first part of your question with respect to how patients in our community receive care, when we received news of the coming pandemic, the initial response that we saw from many members of our community was a reluctance to come to the emergency department. It seemed as though there was an overall shroud of fear that coming to the hospital would lead to their contracting COVID-19. There were some unfortunate episodes of individuals waiting too long to seek emergency care. So you had individuals who were waiting at home a little bit too long with the abdominal pain that later turned out to be appendicitis, or a little too long with the chest pain that later turned out to be a heart attack. And what we found was that the delay in care had direct impact on some of these outcomes. Over time, we've seen some of the initial reservation begin to lift, and we're seeing more patients seeking more timely and appropriate care. And I'm not sure if it's a product of the data of a continued healthy, robust workforce. We don't have the effects that you see in the media of frontline healthcare workers contracting the disease on the job. We're so fortunate to be part of a health system and a county that's provided us with robust PPE. We've had very, very collaborative and exhaustive efforts to ensure safety for both our patients and our staff members. So I think it's a product of both testimonials, a healthy workforce, as well as patients who've sought care, who've received care, and they went home better than when they arrived. So I think it's a combination of both that's led to some of the lift of that initial reservation. I do want to emphasize, though, that we are a 24-hour, 7-day-a-week operation, and we're always poised to care for all of our patients. So please don't hesitate to seek care. We will keep you safe. And then on to your next question with respect to the flu season. There are a lot of symptoms that both COVID-19 and influenza share. And so as a result, the resounding message that I'd like to send is for everyone to please get your flu shots. If you don't have primary care physician relationships in the area, now is the best time to establish them. Flu vaccines are widely available. They're available at grocery stores, at pharmacies, and obviously with your primary care physicians. We are part of a health system that is poised to handle patient surges should we experience that. But we're confident that the mask usage, as well as the hand hygiene, the preventative measures that we've been touting as being effective for COVID-19 might potentially help positively impact the effect of the flu season on our community members. And then lastly, what keeps me up at night? I do have still very deep, persisting concerns about the vulnerable members of our population, specifically the elderly, those with competing medical conditions, those who are undomiciled or homeless, and our residents of color. And I want to, kind of share that vulnerability that I, as a frontline worker, I do, think about these patients. And at times I am kind of buffeted with optimism that as we continue to follow the evidence-based advice with respect to mask usage, hand hygiene, continued social and physical distancing, that those measures will have a downstream positive impact on those vulnerable members of our population. Thank you.
Thank you, Dr. Pugh. That was very helpful. And I think, especially as it relates to the questions that people have on regarding the flu, the comorbidities, the vulnerable populations, and seeking that health care that's needed and not waiting, I think that was quite helpful. So around the world, we've seen a decrease in in-person doctor visits. And I think that many of our residents are wondering if telemedicine will be the standard moving forward for a lot of healthcare. Dr. Celian Valero Colon, can you speak to how telemedicine has transformed the way you engage with patients, and what other ways practices can make themselves more accessible as we are embracing this new innovative future while delivering care?
Hello, sure. Good evening all, and thank you for having me here. So telemedicine refers to remote clinical services using a secure platform. I think of telemedicine as another way of reaching out to the community for healthcare services. There are specific circumstances where a patient needs to come to the office, and there are other conditions that we can manage with telemedicine services. At the end, the goal is to take care of the patient without delaying their care. A good example is a working mother that is working from home, helping her children with remote learning. She has questions about her health. She can have a remote visit with me or a primary doctor, ask all the questions. We can prescribe, send referrals, adjust therapy without her leaving her home. If we need to bring her in, of course, we will make the arrangements to do so in a safe manner. Over time in our practice, we have seen an increase in the acceptance of for telemedicine services. And currently our practice is a hybrid. We are doing telemedicine and in-office visits. I feel like we not only love the fact that is safe for our patients, but also is very convenient, and that is we do that without compromising their care. Other ways that I feel like practices can improve or be useful to the patients is having a great office support, train the providers and staff on policies, practices, and protocols, having an EMR, electronic medical record system with access to portal messages to the providers and staff, and reliable on-call answering service.
Thank you so much. I think as we are coping with this time of change, we need to change with it to ensure that we are having that affordable access to healthcare. And so that was very helpful and insightful. Now, mental health has been a significant concern for many of our residents and for myself personally, especially as more people are spending so much time at home and feeling more isolated. I've been especially concerned for our young people, as last year we launched our It's Okay to Ask campaign to raise awareness about youth suicide. Denise Giuliano of NAMI Howard County, one of our important partners in mental health, can you talk a little bit about what you see as the critical needs surrounding mental health services here in Howard County?
Absolutely. I just wanted to say thank you also for having me here and to take just a second to talk about what NAMI Howard County does. For those of you who don't know, we are a nonprofit organization that provides free education classes, support groups, and advocacy to individuals and families living with mental illness. If you want to find out more information about our programs and services, visit our website at namihowardcounty.org. So now to your question. Yes, I think it's fair to say that unless you are made of steel, this pandemic has had a real impact on your mental health. I know it certainly has on mine. And I want to say that it's okay not to be okay. This pandemic has affected us in ways that we never imagined. And I think we need to show each other some grace and show ourselves some grace and understand that we're all going to get through it, as painful as it is. But I think that's an important thing to say. So what are the critical needs surrounding mental health? In short, more funding at the federal level would be a good start. And for the healthcare system to treat mental health in the same way that it does physical health. A person who has a heart attack goes to the hospital and likely has no problem finding a cardiologist and finding insurance that will cover the procedure. But unfortunately, it's not the same with a mental health crisis. Oftentimes people struggle finding a psychiatrist that takes insurance because the reimbursement rates are so low for providers that it doesn't make sense for many psychiatrists to take insurance. But unfortunately, that leads to many people being denied care or not being able to afford it because they need to pay out of pocket. So that's a big problem. I would also say more intensive community services for families. This has been a problem since prior to COVID-19, but I'm talking about supportive housing and employment for adults with mental illness to enable self-sufficiency. Respite care for caregivers. I just have to shout out to all those caregivers out there who are trying to maintain their own mental health as they're trying to manage those of the mental health of their loved ones, particularly during this time. It's incredibly difficult. We need more therapists that are available on short notice when there are these mental health crises. People shouldn't have to wait. More psychiatrists that take insurance, which I mentioned because the reimbursement rates are so low. Jail diversion and reentry services. I know your administration is doing some work in this area, Dr. Ball, and I really appreciate it. But these needs are only going to intensify as the pandemic drags on if they're not addressed, not just at the county level, but as part of a comprehensive state and federal program. So I think that's about it.
Well, thank you so much. I think, as you noted, too infrequently do people think about the mental health aspect in addition to the physical health aspect. And I can let you know that those of us who are made of steel also struggle a little bit too. And I think maybe one of the most salient points that you made was that these challenges weren't created by COVID-19, they were revealed. And we have a lot of work to do. And so thank you so much for your insight. This is also an area that can be addressed by Lisa Pearson, who's head of behavioral health at Chase Brexton. Can you talk a little bit about the ways that you have had to change business operations to better engage our Howard County residents? And are you seeing your clients showing different needs?
Good evening, everyone, and thank you, Dr. Ball, for allowing us to be able to see one another, our partners in the community with this shared responsibility is amazing to be able to talk about. I think we have certainly seen COVID-19 expose our best and our worst. And in terms of our best, I think therapy, in the work that we do, we try to help people learn new ways of doing things and new ways of looking at life and developing coping skills. And we had to do that very same thing and quickly moved upon the executive order from moving all of our visits that were in office face-to-face to phone visits. And then the following week, our IT teams uploaded a platform, secure platform for us to be able to work within our EMR to meet with our patients through telehealth. And so we were able to make this shift and keep our patients safe in a time where the stressors were extremely high. So proud of all the people who helped make that happen for our patients. Similar to what Denise was sharing, it also opened up our vulnerability around providing services for the underinsured and folks who don't have reliable internet technology and the ability to participate and to continuing those services with folks by phone has been incredibly crucial in this time of intense emotional support. I think one of the things that we also were able to do was to provide support for the people who are the helpers. So the therapists themselves created internal teams to take care of one another and really recognizing our humanity with our medical teams, our dental providers, our social workers, and providing the skills that we knew are helpful in helping people cope, but providing it to all the teams so that we were able to actively use those in this incredible time of need. So I think my main takeaway would be shared responsibility, shared care, and even those who are made of steel. I think one of the things that's been extremely helpful to utilize on a day-to-day basis is the Horizon Foundation has a campaign about how to be an emotional support human. Awesome stuff, good things to have at your fingertips and to be able to utilize in these tough times.
Thanks again for reinforcing. I think, as we're seeing so many of these challenges, it's difficult sometimes to work through some of these feelings and these difficulties. But as you noted, not only do they make us human, but as we embrace our humanity, that's what helps us get through. And it is critical that we don't forget that. And in addition to mental health, we've also seen significant racial disparities for those impacted by COVID-19 in Howard County and also around the state and the country. Steve Snowgrove, who is president of Howard County General Hospital and another one of our partners, can you talk a little bit about what the role the hospital has played to address these health disparities found in COVID-19 that have been revealed over time?
Certainly, Dr. Bob, but let me first thank you and my good friends, Dr. Rossman and Dr. Levy, and all of the healthcare professionals who have come together in their roles of keeping this community informed and following best practices. And I want to give a particular shout out to the physicians and nurses and respiratory therapists and all the facilities people who have had to work in the hospital and to really transform it to not only take care of COVID patients, but to take care of our non-COVID patients as well. As we've heard many times this evening, we all know what to do. We've all been wearing masks, washing our hands, and keeping socially distant. And Howard County is truly the beneficiary of that. As some may know, but others may not, our hospital was projected to get some of the highest COVID volumes in the state. But because of the things that we've been doing as a smart community, we've only had about a third of the volume that was originally predicted during this first surge. And I encourage all of us to continue to do this as we mitigate what may come. Our COVID patient volumes have really varied over the last few months. And right now, as we mentioned, they're relatively low. We've tested over 20,000 people at the hospital here since the pandemic began, including about 9,300 in our emergency room and another 11,000 through our drive-through tents. And the average turnaround time is about 10 hours in the hospital and less than 48 hours for the drive-through tent. And this is really critical to the tracer work that is going on in the health department. Over the last 2 weeks, the positivity rate for those tested in the emergency department has really been declining and has dropped by nearly 3%. On average, in recent weeks, we've only had 1 to 2 patients per day in our intensive care unit. So we're seeing a lower level of acuity as the age of our population who's being exposed to COVID comes down. And yes, there are truly healthcare racial disparities, even beyond COVID in our community, but specifically with regard to COVID, we've been working with the health department and we've identified trends in areas and hotspots. For example, with both the Latino and the African American communities. These communities are showing higher rates of COVID and sometimes more complexity. And we've worked with our partners on testing, education, and outreach. We are also working with our local skilled nursing facilities and other at-risk populations. And we have implemented even better communication and coordination during this COVID crisis. This includes systematic check-ins, structured education, and stronger areas of coordination of care. It's also important to note that as members of the Johns Hopkins Health System, we have also worked to ensure better outcomes for our vulnerable and at-risk populations who have been treated for COVID at the hospital and then discharged. We've set up a system for in-home oxygen saturation and heart rate monitoring of these vulnerable patients in conjunction with Johns Hopkins home care services and with on-call access to the Hopkins pulmonary physicians who are really extraordinarily strong. It's these types of efforts that go a long way to minimize our health disparities. Despite our very widespread testing, we know we are not reaching all of our communities. And that's why we launched community testing with our Journey to Better Healthcare program. We have 16 events scheduled between July 19th and October 31st. Through the first 5 events, we've tested over 1,000 people, 50% of whom are Black, 10% are Hispanic, and the turnout has been terrific. We've taken scheduled patients and those who just show up and driving in because they've heard about it. And the overall positivity rate is 2.7%. When patients test positive, we check on them to make sure they have everything they need, not just the knowledge of the test, but access to medicine, food, and knowledge about how to safely quarantine. As part of Johns Hopkins Health System, we are constantly evaluating health equity. And I hope everybody in the community recognizes it's one of our top strategic priorities.
Thank you so much. We greatly appreciate the partnership of the hospital. And also, just on a personal note, thank you for your service when it comes to economic development, too. I think you astutely noted the relationship between these physical and mental health disparities and not only having access, but education, and then finally empowerment. So thank you so much. Now, these health disparities are not new, as we've already talked about before. They are just being revealed and highlighted. And as was noted earlier, the Horizon Foundation has done incredible work on highlighting the collective action our community needs to improve many of these outcomes across both racial but also socioeconomic lines. Dr. Akendo Baruz, as a Horizon board member, how do you see your current role at Care First and your role as a board member intersecting for our community? You're still on mute.
Yep.
I got her. Oh, no.
So you can hear me?
Yes, perfect.
Can you hear me?
Yes.
Okay. So first of all, Dr. Ball, I want to thank you for inviting me to this important community conversation. I really feel very fortunate and proud to live in this community. And I'm very proud to serve as a board trustee for the Horizon Foundation, and equally proud to be affiliated and working for Care First now as one of their medical directors. This pandemic for sure has brought front and center health disparities all over. And Both of these organizations, the foundation and Care First, has responded robustly to help mitigate that. So the Horizon Foundation, under Nikki's Highsmith leadership, she quickly responded to the needs of the community, putting together funds with other nonprofit funders to really make available grants for community needs. And if there have been many grants that have been granted, over $700,000 in grants for the community. The foundation has also committed to $1 million grants for COVID emergency relief for frontline workers. So that's on my role as a board trustee. In my other hat, as a medical director for Care First, I feel really proud because Care First immediately, in response to this pandemic, took a really aggressive action to support the community at large. And they committed $2 million of investment in nonprofit organizations to really serve these underserved communities at all levels. You know, the funds will help close the gaps in medical access, minimize food insecurity, support the needs of population that are disproportionately impacted during this crisis. Also, because Care First is the major health insurance in this area, you know, they really responded quickly to the needs of the provider communities, because our provider communities basically overnight had to convert to telemedicine. And many of them, you know, really were financially strapped. And Care First went out of their way to support them and even do advances, and not only in medicine, but in the dentists who were also impacted. So I feel that very proud to be affiliated with these two organizations, and I think that both of them have done a tremendous job and will continue to do to really support our community and to minimize those health disparities.
Well, thank you. That is not only truly insightful, but I just want to personally thank you again for your years of service and leadership, particularly to the traditionally underserved. And I think that now more than ever, we can all come together and chart a new course, a better course. But beyond traditional healthcare, Johns Hopkins Applied Physics Lab has been an excellent partner throughout this pandemic and, of course, before. And they're researching the efficacy of different tests and preventative measures. My friend, Dr. Semmel, can you please provide more insight on how APL is leading not just Howard County, not just the state of Maryland, but the country during this pandemic, and then also Howard County specifically?
Sure, and thanks for including me tonight. It's a real honor. So thanks to Calvin and Howard County team for all the work that you all have done over these past 6 months to keep county residents, including thousands of APL staff members and their families, safe and healthy. You know, as I've said in other forums, being a COVID survivor myself, I'm particularly appreciative of the county's thoughtful approach and actions. APL is an organization that focuses on the most critical challenges facing our nation in national security, space exploration, health, and other highly technical areas. And clearly, this pandemic has posed plenty of critical challenges. While our primary focus is at the national and international levels, we take great pride in our role and responsibilities as members of the Howard County community. Now, you may be familiar with some of our national level work. For example, our engineers automated and integrated information from local communities into the well-known Hopkins map of COVID-19 that you routinely see on the news every day. And this is now something folks use to formulate everything from business travel guidance to community policies to individual vacation plans. And in addition, our data scientists have been adapting statistical techniques that allow for a better understanding of the course of the virus and how it spreads, including the identification of emerging hotspots. Beyond that, more than 50 of our staff members have been providing analysis to the nation's COVID task force. And that analysis has been informing the allocation of federal resources to include how, for example, remdesivir should be distributed to hospital systems. Now, with respect to Howard County, about a month ago, we signed an MOU, a memorandum of understanding with the county, to provide advice on serological testing. And we're working now to develop a framework with the county to help structure a serological study that would improve our understanding of the disease prevalence among the residents of the county. We also use modeling and simulation to help Johns Hopkins Health System manage their capacity to care for COVID-19 patients across the 5 Hopkins hospitals in the region, including, of course, Howard County General. And in addition, we've advised the county on the effectiveness of UV lighting systems and continue to explore various options that might neutralize virus particles. Now, there's much more, but I thought I would close with one other element that's a little bit different, perhaps. And I'll mention, and it builds on something that Angela introduced before, we're always looking to push the bubble on innovation. And so Angela described how we were selected by Fast Company as the 3rd best workplace for innovators out of more than 860 companies that were considered. And we're right here in Howard County. And in fact, we came in just behind Google, who finished number 2. Now, one example of that push for innovation is a small quick turn project funded through our innovation program. And specifically, we've been exploring if breweries that are used to make beer could be repurposed to make antiviral medications. And while the results are preliminary, this actually, in a more serious note, aims at a very critical national vulnerability that has been highlighted by the pandemic, which is that America is almost completely dependent on China and other nations for pharmaceuticals. So you can see by exploring different options, we might be able to come up with solutions to problems that have in the past defied solution.
Thank you so much again for your friendship and partnership, Dr. Semmel. Many people don't know, but APL is actually the county's largest private employer. And not only having so much workforce development, but also many of our residents and having one of the top innovators in the world here is, I think, a benefit to the county, the state, and the region. And so this partnership is invaluable. Now, what's an important takeaway that we've gathered over the last 5 months that we're facing this virus for the long haul? It's going to require sustained effort from all facets of our health system and our residents. Certainly, last but not least, my frontline, not just cheerleader, but person who is on the front lines working as the county and state's superhero health officer, Dr. Mara Rossman. What do you want Howard County residents to know at this point in the pandemic? And can you talk a little bit about your priorities as our health officer?
Well, thank you, Dr. Ball, for those really kind words. And those that do know me, I love the metaphor of the superhero and wearing the tiara. So thank you. And thank you, all of you esteemed colleagues. I know everyone here, this has really been a team effort to flatten the curve and respond to COVID-19 pandemic. Typically, public health is a behind-the-scenes player in promoting, protecting, preserving the health of our community. Over the past 6 months, I dare say, I think many people recognize me, know what a health officer is or what they do, and public health. And you're right, we are the boots on the ground that day in and day out, when you typically go out to eat, you're eating safe food, Typically in the summer, if your kids are swimming in a swimming pool outside, that pool is safe. And when you go inside to an employer or other facility, again, that things are safe and that overall people have access to care and equitable care. The public health system across the United States and obviously in Howard County has been tested to the limits. And I am so proud and fortunate to be the health officer of this community and about 200 employees. We've had to scale up to do the things that typically local public health does, but now on absolute steroids. And we could not do that, again, without everyone's help here on these screens and without the discipline, dedication, and trust that our Howard County residents have in our county government, in our county health department, and in our Maryland Department of Health. I want everyone to know that day in and day out, we are relying on data. We started out with zero data in March 15th, which was our first case. And by now we have mega data that we continuously analyze so that we can provide the best data-driven decisions and information to Dr. Ball, to Dr. Levy, to Mr. Snellgrove, to Howard County Hospital, et cetera, everyone here, and we will continue to do that. Our goal is to keep everyone as safe and possible given this pandemic. We've heard about the mental health toll that this is taking. We know about the economic toll this is taking. We know about the educational toll this is taking on our kids and that of our vulnerable population. So I want everyone to know that every day that we wake up, and it's not just me, it's everyone here that you see, and it's the 200 employees behind me who are dedicated to promoting, protecting, and preserving everyone who lives, works, and plays in Howard County. And we thank you. And as Dr. Ball mentioned, we're in for the long haul. Public health is always in for the long haul. We don't usually have quick results. And my goodness, this is testing us because this is really taking a long time. But hang in there with us and we will get through this together. So thank you.
Thank you, Dr. Rossman. Your quite insightful remarks remind me of someone who thought that they were signing up for a 5K and really signed up for the Marine Corps Marathon. And they thought, well, this isn't the race that I signed up for, but this is the one I'm in. And I think this is the one that we're in together. I think it's easy in these times of staying home and isolation not to see how all of the different layers of our systems are working together and cohesively to combat this virus and help keep people not only safe, but healthy. And for all of you, you're excellent examples of the investment in both safety and health. Now, I'm going to turn it back over to Angela Cabellin to talk a little bit about some of the questions that now we've received from our community. Angela, back to you.
Thank you, Dr. Ball. Yes, please continue to send your questions on Facebook Live as well as the WebEx chat. The first question we have is from a pre-registered attendee, and it's about face shields. They ask, now that plastic face shields are becoming inexpensive and widely available on the internet, what role do you see them playing in preventing the spread of COVID-19? Can face shields be worn alone, or do they need to be worn along with a face mask? Dr. Rossman, do you want to start off?
Sure, thank you for that question. So what we've learned since this COVID adventure is that one, facial coverings, plain cloth coverings, not the kind that are worn in the hospital, can greatly reduce transmission between people. And that has to do with the fact that COVID-19 is mainly transmitted by aerosolized droplets. And there's all different sizes of droplets. So again, facial coverings at this point of any kind is the best way to protect you from giving COVID to someone else or from getting COVID from someone else. Face shields work best in protecting the mucous membranes like the eyes, the nose, and the mouth that may not be able to be covered by a facial covering. So you'll see plastic masks and other eyewear usually worn by healthcare professionals because, again, they're trying to protect mucous membranes in addition to the respiratory exposures. For the general public, it really depends on the type of work you're doing or with whom you may be interacting in your home. And we all have different risk factors. So, one, if you are unable to wear a facial covering, a plastic face shield is better than not wearing any facial covering. If you feel like you really need to protect your mucous membranes, then you should wear both a facial covering and a face shield. So the answer is facial coverings work best. If for some reason you need to be super protected, wear both. If for some reason you cannot wear a facial covering and the only thing you can wear is a face shield, then that is second best.
Thank you, Dr. Rossman. Thanks to all who are watching on Facebook. Please feel free to share this live broadcast with your social network and just ask a question in the chat and we'll try to get to it. One question from Facebook is from Nimbus, who asks, how long is the wait for the drive-through tent testing at the hospital and who handles the tracking of COVID cases?
So at the hospital, this hospital tent actually requires a referral by a physician. And we have capacity to do about 500 tests a week. We're doing that pretty regularly. In fact, we're working with the health department to see if we can do some more for the community. But it does take about 24 to 48 hours to get a result back. And we will communicate with you through my chart. And you have access to that to look up the results yourself. And if we don't hear from you, we will give you a call.
Thanks so much, Steve. We appreciate your answer on that. We have another question that has been emailed to us. And here it is. It says, Howard County is seeing more COVID cases disproportionately in Black and Latino communities. Why are they being impacted more than their white or Caucasian and Asian counterparts? What is the county specifically doing in terms of outreach, engagement, and education to communities of color? So it sounds like this question could be taken from a number of our panelists. And I guess we can start. I think, Steve, you did mention some of the things you're doing on health disparities. Perhaps you and Dr. Pugh can start off and we can also open it up to our other physicians.
I'll start off, and really it is a partnership with this whole group. And I think particularly the health department as we begin to identify hotspots in the community and try to reach out to them by meeting them where they are instead of expecting them to come here. I think communities, racial disparity exists dramatically in this disease. And I think when you think of the socioeconomic factors, there are many people who need to work to survive, and there are multiple generations living at home. And so I think that's put disproportionate risk on some of these communities. So it is something that we as an entire community have to come together to work towards.
Yeah, this is Pat Pugh. I second everything that Steve just said. What we found just working in the emergency department is that many members, particularly earlier on in the pandemic, while everyone else was allowed to kind of quarantine at home and work from home, there were many essential workers that were still faithfully reporting to work and gallantly. And many of these individuals were persons of color who live, like Steve just said, in multi-generational homes. And they were contracting the disease because they were out in the community performing essential work. And we also found that it was very challenging to go home and to be able to self-isolate just because of the actual ergonomics of what home looks like. And when we started to realize that there was a disproportionate uptick in these populations, we've had a great partnership with the health department with twice per week meetings with Dr. Rossman's team in identifying these hotspots, specifically even by zip code, Howard County kind of subdevelopment names. And under the direction of Elizabeth Minicherry, who was just fantastic throughout this whole process, we're able to kind of go to these hotspots and perform targeted education. We also, in the hospital and in the emergency department, those who were well enough to be able to be discharged home from the emergency department, if we found that their primary language was not English, we would make sure that instructions, really specific, practical, user-friendly instructions were provided in their primary language. So those were some of the kind of practical responses that we had when we saw the disproportionate effects on individuals of color in our community.
Dr. Kendo Barus or Dr. Celian Valero Colon, would you like to chime in?
Yeah, I was going to comment that particularly with the Latin community, they mostly live in multi-generational households. So you may have several families living in the same household, and they are also, like the previous two people that spoke, they usually work in essential workers. So they have been out there, but also part of this community is undocumented. So that makes it even more difficult for them to access care. So that is something that has to be kept in mind. Fortunately, we have Chase Brexton in Howard County that serves this population, but that has been very, very challenging with the Latin community.
Thank you for that insight. Okay, we'll go to the next question from Facebook, from Shannon, who asks, are there any initiatives to help deal with our children's mental health beyond suggesting counseling? So perhaps NAMI, Denise, could you chime in here?
Sure. One of the things that NAMI offers, as I mentioned, were support groups for parents. We have two of them. One is for parents of school-age kids, and one is for parents of transition-age youth, which tends to be around age 16 to 26. It's usually a pretty difficult, that's when most mental illnesses emerge, and it also can be a very challenging time to launch your child into adulthood. We also offer classes there for parents as well, the same for parents of school-age kids and parents of, transition age is also, covered under the our basics program. But we also offer some classes that we do for teens in the schools. I'm not quite sure how it's going to work this year in our virtual format. We haven't quite figured out if we're going to have a place in the new curriculum, but we're still working through that. I hope I answered the question.
Yep, thank you. Lisa Pearson, did you also want to chime in on what you're seeing and things that, having practiced clinical social work regarding mental health?
Sure. I think what's really important during this time is to recognize the scope and the need that all children won't need a therapist, and to really be abreast of what Denise was saying. What support groups are there? Although we're very, very adamant about physical distancing, we're really stressing how important it is to stay socially connected. And for each of us as parents, as teachers, as guiding adults, to help our children recognize what those needs are that help them feel connected, and being able to provide those things for your child who's artistic. Do you have the art supplies? For the musically inclined, is there music? Is there dancing? Is there movement? But being able to have those things at the children's fingertips and our adolescents to stay connected with friends and trusted adults. It's really, really important now to physically distance, but stay socially connected.
If you don't mind, I just want to add one more thing, especially
Sure.
as we head into school again, that it's important that the parents and the caretakers and guardians of the kids take care of themselves. And this is particularly important, I think, for women and women of single households who are not only working, taking care of the children, and now responsible for ensuring that they're educated. So again, we all have to take care of ourselves and look out for each other so that we can care for our children.
Thank you so much, Dr. Rossman. Well said. We received a WebEx chat question, and it's about the health and welfare of our first responders. The question starts off with, thanks to all those on the front lines. You are our heroes. My question is, how is their health? Are they staying COVID-free? Is their mental health strong? Dr. Levy, how about we start with you?
Great, and thank you for for the individual who asked that question, because it really is very much front and foremost on my minds, the minds of Fire Chief Bill Anashevsky and our leadership team, as well as the Police Chief Lisa Myers, who also deserves a tremendous amount of credit for the work we're doing. I would offer a couple of thoughts. First responders are people too, like everyone else. Parents, spouses also have the same challenges of maintaining balance in the home in addition to the workplace. So we strive really hard to provide those services and support that we need to. I would say that this is an incredibly resilient group of individuals, and they're doing well. We have had cases of employees, of individuals who have had COVID. I'm very proud to say that we have implemented a tremendous amount of discipline and PPE supply and resources, as my colleagues have already mentioned. And we have not had a case where we can link that back to an occupational exposure. And that's a testament to the discipline and the services that we put in place. So I would say the overall health is good, is strong. Morale is in okay shape too. It's as well as we would expect it to be at this point in such a protracted event. But these are individuals who really take a tremendous amount of pride in the work that they do, and it's just all inspiring to see the outlook and the positive attitudes that they have.
Thank you so much. And Steve and Dr. Pugh, do you want to add to that?
Yeah, I'd love to add to that. And the pride and resilience of Dr. Levy's team is obvious, just in the way that they partner with members of the emergency department in caring for all patients, regardless of what their complaint is related to COVID or not. And I just want to thank you for your stellar leadership, Matt. Within the emergency department, we've been blessed to be able to have essentially a workforce that has not been touched personally by the COVID-19 infection. At the beginning of the pandemic, there were lots of anxious thoughts. There were lots of aggressive precautions. Members of our emergency department, be it nurses or technicians or physicians, precautions that they were taking to make sure that if they did get sick, that they would not bring it home to their elderly parents or to their young children. And over time, we found that with the consistent use of our personal protective equipment, we've been able to maintain a healthy, robust workforce. A lot of that has to do with discipline. The morale, the morale has been really exemplary, just overall. I mean, we've had our difficult moments, our challenging moments, but we're so kind of interconnected and so socially dependent on one another in a team-based way that we really look to each other for strength. And so there's a lot of encouragement that kind of happens in real time as we encounter challenging cases or heartwarming cases that our team provides to one another. And I'd be remiss if I didn't say that the support from the Howard County Foundation, members in the community, there was a kind of a champion hero kind of drive-in that Dr. Ball participated in. And so many members of our department kind of lined outside of the hospital as multiple members of the community kind of drove through with their signs thanking us. And that was really heartwarming. Like Matt said, you know, we are people too. And so knowing that the members of our community, many of whom are our neighbors, really appreciate what we're doing, it really matters and it fuels us. So I just wanted to say thank you. Please don't fatigue. And thank you.
Thank you. That was just wonderfully said. Dr. Celian Valero Colon, did you want to add about what you're seeing in your workforce? Would you like to add to that?
Oh, thank you. Yeah, so then we are working very close with our patients, and then we are offering, again, for the healthcare providers, we offering, again, we're going back to the telemedicine, a great resource for these doctors, nurses that are working 12 hours, maybe sometimes more, so they can still get in touch with us and provide the care that they need. So we are there available and offering resources for them to at least even talk to us. If they need any referrals, consultations, we are there. We're here and available for them.
Thank you so much for that insight. We now have a question from a WebEx participant who asks, I don't think we will get back to normal until we get a vaccine and get everyone to use it. But 25% of Americans say they won't take it immediately. My question for Dr. Semmel is if APL is working on this issue, is APL working on this issue and what capacity?
So we are not working directly on that issue. You know, there's you know, a number of folks have been thinking about what it really means. We've been having discussions at the lab, what it means to have a vaccine, what requirements should we put in place at the lab for the vaccine, when does herd immunity kick in? You know, you've heard all different kinds of numbers from 50% all the way up to 80%. But we're not working on that directly at a national level at this point.
Let me add to that. Johns Hopkins is actually doing some research on the vaccine as well as many other universities and government agencies across the nation and the world. And I think it's fair to say that we're going to have a vaccine in the not too distant future. But then we're going to have to figure out from a regulatory perspective what kind of requirements are going to be made. And the health department and the elected officials are going to have a say in this. You know, at the hospital, we actually have had some of our employees come down with COVID. We've worked very closely with the health department to monitor that and do the tracers. Many of the people who've come down with COVID haven't come down from hospital exposure, but it's been through the community. And so we've got to recognize that we have to make some very disciplined decisions to ensure our safety.
Actually, so if I could add on to that. So it does, you know, we are doing work with respect to, I mentioned remdesivir before, for example, and that requires a deep understanding of the disease. And this is building on something Steve was saying, because we worked with the Johns Hopkins. We recently had a team that included Hopkins Medicine and other divisions that sequenced 143 samples of the virus. and that was collected through the Johns Hopkins Health System. And this was of early COVID-19 cases in the National Capital Region, so just our area. And we found all 5 of the major variants of the virus that were present early in the pandemic. And of course, this suggests that there are multiple introductions of the virus into the geographical area. Now, it's not clear, at this point, what kind of, it's a slow, we believe it remains a slowly mutating virus, which is good from a vaccine standpoint. But, we still don't fully understand the full mutation potential of the virus as we look ahead.
I just want to remind everyone that vaccines are, from the past century, something that has saved millions and millions and millions and millions of lives across the globe. And all of our children are vaccinated for school, and COVID vaccine will be another tool to protect ourselves from another infection. So we have a lot of experience with vaccines, with vaccine safety, and knowing how vaccines save lives. So until COVID vaccine is available, influenza vaccine is available, as I think Dr. Pugh mentioned in the beginning. Go get it now, get it early. And when the COVID vaccine comes out, if you have questions, there will be health professionals, public health, as well as providers, APL, to be able to address whatever concerns that one may have.
Thanks so much, Dr. Rossman, Dr. Semmel, and Steve. Those insights regarding vaccine were just very key. Thank you. Now we have a question that came in earlier this evening from Beth on Facebook. And she wants the 21% of the population data indicator to be clarified. She asks, does this mean that same people are getting tested repeatedly, or has 1 in 5 people in the county actually been tested? Dr. Rossman, can you please talk about how we are using data to track COVID in Howard County, and a little bit more about the population tested?
Sure. Thank you for that question. So the 21% of the population that has been tested, that means that it's actually a little more than 68,000 Howard County residents have been tested once. We've tested in total almost 100,000 tests. So that means there's about 30,000 residents who have been tested more than once. I think we all appreciate that one and done with COVID testing, not so good. So that testing needs to be serially done or repeated when someone becomes symptomatic or has been exposed.
Thank you so much, Dr. Rossman. Okay, we did receive a pre-registered email that asked, and I think this is a question for our Howard County government folks, says, what is the policy of the Howard County government regarding whether employees of businesses, organizations, establishments, and facilities are required to wear facial coverings that provide effective source control? So it looks like Dr. Ball is going to chime in there, and go ahead, Dr. Ball.
Well, I'll start it off. I think that the governor has given orders and is trying to really help with a facial covering mandate. And as I'm seeing a great many of our businesses and public spaces around the county and the state are employing those mandates, I think what we see is the more that it can be done, the more that we can manage the spread. I think several of our panelists have talked about that, and we are trying to ensure that we enforce that. And I guess I'll turn it over to Dr. Rossman if you want to talk a little bit more about the enforcement mechanism and process.
Yeah, so thank you, Dr. Ball. You're right. I think where we are right now with our data is a reflection of people wearing facial coverings, physically distancing more than 6 feet, washing hands. And we're seeing that across the country that our data has improved as there have been more states and counties with facial covering orders. It's really important to continue these efforts for the facial coverings, because right now, without medication, without flu vaccine, that's our best bet to keep healthy until such time that medication and vaccine is available.
Dr. Rossman, since you mentioned vaccine, there was a follow-up question on Facebook about what is a realistic time frame for a vaccine, considering clinical trials need to be done. I think people are reluctant to take the vaccine because they think that it is being rushed and not going through the proper process.
Yes, I'll be honest. I'm hearing from the state and from other places, CDC, that vaccine may be available as soon as November. I'm trying to be optimistic because I would like vaccine. I'm a believer in vaccine. I don't really think that's realistic that there will be vaccine available for the general masses, probably until the end of this year. And I certainly trust the FDA that they will not be releasing an unsafe vaccine that's also not efficacious. So, and certainly I'm being candid here. If I'm pressed to actually deliver a vaccine that I don't think is safe for my community, I will let you know. So I'm hopeful that the beginning of the first of the year that we may begin to have vaccine. And I expect when vaccine becomes available, it will be phased in by priority groups, because it does take a long time to scale up the amount of vaccine that we will need for everyone in the United States. So it will take a while to manufacture sufficient quantities and also to obviously vaccinate everyone in the United States.
Thanks so much. And our last question came in from a pre-registered attendee who asked, and this is for Dr. Pugh, is the hospital testing all patients who come into the ER? If not, what are the parameters for getting a test when visiting the ER?
Oh, thank you for that question. We've kind of traveled along a continuum of testing since March. Initially, as you know, there was a national shortage of tests with the kind of single-minded focus from our health system and various health systems kind of in the region. Johns Hopkins Health System was able to create its own test. We do currently test all patients who are being hospitalized through the emergency department. So if someone is coming in and they're coming in, whether it's related to COVID-19 or not related to COVID-19, they are receiving a test. We think that's part of kind of community responsibility. It helps with disease surveillance, and it also helps ensure safety when it comes to taking care of that patient from the start of their malady through the end while they're hospitalized in the hospital. It helps us cohort our patients so that we can employ safe kind of disease prevention methods on both sides.
Thank you so much, Dr. Pugh. As we wrap up this health and wellness town hall tonight, we've just had the great fortune of having, locals and then national experts right here in Howard County speaking to very important health and wellness topics, all representing the ecosystem here. We want to thank all of our panelists, our leaders who have and continue to play a role, not just during this pandemic, but beyond. And now I'm going to turn it over for County Executive Calvin Ball for final remarks.
So I just want to echo Angela's appreciation. We have such a fantastic, well-respected panel, and these leaders who they have day jobs are here with us this evening, and you all have been so gracious with your time and your insight and expertise. Thank you so much. I want to thank our IT team, because without them, none of this would have been possible. We would have just had people in separate rooms talking to themselves. And so thank you so much to our IT team who made sure that this happened. I want to thank Angela again, who continues to be such a remarkable leader. She's someone who, when I go in with an idea and something that I want done, she just helps make it happen. And finally, I want to thank all the viewers and everyone who engaged, because this is going to be a community-wide endeavor. And only when we come together through collaboration, through communication, can we continue to endeavor to keep ourselves safe and not only survive this pandemic, but get to the other side and thrive. So thank you so much. Please be safe and enjoy the rest of your evening.
Thank you, Dr. Ball. This now concludes our Health and Wellness Town Hall. Thank you and good night.
This meeting is no longer being recorded.